Hi everyone, my name is Gamba. I'm an obstetrician and gynecologist, and I've partnered with AJ Plastics to offer comprehensive gynecological treatments to women and girls. And part of the deal that we offer involve postpartum care, mommy care, in terms of reducing weight and also giving bilateral tubal ligation in the process, and also we offer reconstructive surgeries in terms of hymenoplasty, vaginal rejuvenation, the non-surgical and also surgical components of cosmetic gynecology that I'm also very interested in.
So what is mommy makeover? That is a question that I get over and over and over. And I think it's a combination of procedure. And I'm very, very happy today to have a specialist in the obstetric and gynecology, because where you left is where, where you're living, that is where you're coming. Okay. Mm-hmm. After childbearing period and postpartum period, ideally is where we offer the Makeover procedure, basically trying to undo the changes that occur during pregnancy. Maybe you can tell us what are the main changes that occur during pregnancy.
Okay, so pregnancy in itself has many changes. They're mostly intentionally made to be good, to protect the mother and the baby. However, sometimes you can have some of these changes that you may not like, especially in terms of your body fat distribution. And of course, there are many other changes that often disappear in terms of increasing your blood volume, increasing your vital capacity for the lungs, also increasing your, your capability, your abdomen expands more. And so that by the time you're reaching your post-delivery phase after the baby is out, some of that skin is lagging, some of that fat distribution happens in the areas you do not want. And Mommy Makeover allows you to get that kind of treatment that you want, because I think one of the interesting things is after delivery, you realize your former self was actually very, very good looking. Yes, so you always want to fight back and get back to where you are. So what we are offering is more of a almost permanent method to just get back to how you are, in addition to your nutritional, of course, and also exercise regimen. So basically what we do, and most of the women possibly come after they've finished their childbearing period, where they now want permanent, results. So what we do for us as a gynae, possibly we offer a permanent method of family planning, and that includes cutting the tubes. And then in terms of now redistributing the fat or removing the fat, now that's where Dr. Ajujo comes in and we do the liposuction. It can be an open procedure most of the time, so we do all this in one sitting. And then after that, also the skin that has sagged, I think there's a way you call it, I don't know how you call it. You can also tell us, yes, give us a bit of that.
Yeah, so basically when you have that skin that is not retracting,
yes,
some people call it fupa, but clinically we call it a panus, meaning you have excess skin with fat, and then also you have rectus diastasis because of the pregnancy, the expansion, the increased capacity to try and accommodate the pregnancy. So that muscle is supposed to snap back. However, in some women it doesn't. And with that you have bulging of intra-abdominal content, herniation basically in medical terms. So when we are doing our abdominoplasty or what we call tummy tuck, you want to repair that muscle so that you have a flat tummy. So it's a structural reconstruction. And then with that, you invariably have an excess skin. So you get rid of that excess skin so that you're able to tuck nicely. That's just one. The other changes that you didn't mention is the breast. So what happens to the breast?
Well, those are good observations. Yes, the breast also enlarges, of course, to accommodate the milk supply that will happen. And sometimes you can find immediately after you finished maybe the lactation period, you find they're a bit saggier than usual, or now they're a bit even more bigger. Yes. So what we call gynecomastia. For some people, maybe it was not there before, but after delivery, you realize they're quite bigger than where you are. And so part of what AJ Plastics also offers is the breast reduction procedures. And of course, usually after you've also finished your reproductive cycle. So maybe Dr. Ajujo can tell us what exactly the breast reduction procedures entail so that we know.
Yeah. So we usually have two growth spurts for when you have excessive breast enlargement. There's the prenatal, post-prenatal period, and then there's subsequent childbearing. So we understand during childbearing is that hypertrophy, when we say enlargement of breast tissue, fat, the ducts, and then after breastfeeding it's supposed to involute what goes back, but it really doesn't. And that is where now we have to come in and surgically reduce the breast and lift. A common thing is also the sagging of breast that happens with childbearing, and we say breastfeeding and pregnancy. Then what we do now is either breast lift or breast lift and augmentation. Breast lift if you just have sagging breast with adequate volume. Breast augmentation if you don't have adequate volume, so you have to replace the volume. And you can combine the two. Sometimes you don't have volume and you have sagging skin, so you have to do the augmentation must always meaning you are lifting and you are adding volume. Okay. Now, this is not to say that women should not breastfeed. I'm sure you're a strong advocate of breastfeeding.
Yes.
But you can tell
Exclusive breastfeeding.
Yeah. So tell us about the importance of breastfeeding and why there's no correlation between breastfeeding and the outcome of your breast in terms of sagging or enlarging.
Very interesting question.
Yeah.
But yes, as a strong advocate of exclusive breastfeeding, at least for the first 6 months, and then continuously up to whichever age you're comfortable, it can go beyond 2 years, wherever you're comfortable. By the end of the day, it's a natural process where you have the baby getting the vital nutrients. This can come about in terms of the vitamins and also the proteins, and also most importantly the immunological component. That is what helps you fight diseases. So you can see most of the people who are exclusively breastfed, things like diarrheal diseases are not as frequent as the people who get these other mixed sources of feeding.
But from experience, there is no really correlation, because I've had patients who come here, nulliparous, meaning they never had any pregnancy, and they have sagging breast or enlarged breast with no history of breastfeeding or pregnancy. So it doesn't mean that the changes that occur, because we're calling it my makeover, is directly due to breastfeeding.
I understand what you're saying.
And then I've had also patients who come here with perfectly looking breast, maybe they've come for just lipo after even three pregnancies, and having exclusive breastfeeding. So my point is that we should not crucify or vilify being a mom. Yes.
I think, I don't know whether it's still online or offline, but what I think mostly, it's more about your genetic makeup, by the way. So in terms of the people who are big, tend to be on the larger, how do I put it?
Large breast, yes.
Nice.
Higher BMI.
Okay, not even higher BMI. People who are just prone to be well endowed in the breast area. They tend to have bigger breasts, and they tend to sag naturally because, of course, the weight and gravity takes effect. But then now, the people who are also naturally small breasted don't tend to have these issues, because the fact that gravity, I think maybe we're blaming gravity, and gravity is not it, but I've not seen any science per se to relate the two. So back to vilifying delivery or pregnancy as a cause of sagging breast. I don't know. I think it's circumstantial. Yeah.
And I don't think you can really say that if you go through childbearing, you have to come from where you come.
Yeah.
I think that should not be the point. The point is that yes, there are people who will have changes after childbearing that will benefit or might benefit from plastic surgery procedure, but it's not equal. It's not one. It's not a correlation. It's not saying that if you are planning to have a baby, save plastic surgery.
Yeah,
I
I get
understood that way, yes.
I understand.
So what I want to discuss was about the non-surgical options for vaginal rejuvenation, restoration, G-spot enhancement. Maybe you can enlighten us. What are the options out there in the market?
I think you've enumerated maybe. Yes. So basically, there's a lot out there, and that's not saying that we have issues as women, but it gives you a different kind of experience whenever you come for any of these adjunctive procedures. That's what I'd call it. So most of the times, it's about either you lack proper lubrication in your genital tract, and then you get some of these laser treatments that allow you to have. And also now, if you want vaginal tightening, there are also procedures that can be still non-surgical, and you also have surgical procedures. And then also just the enhancement of the G-spot. So there are many procedures, but what we have in AJ Plastics or trying to bring to now the women we have here in Nairobi, Kenya. Mostly it's about the laser treatments to now just to try and give you a better experience in your sexual life, and also just for you to feel confident in what you have or what you embrace or embody as a woman. So the exact sequence of events, that is where you're coming.
Yeah, so I think our protocol, we start with the minimally invasive, then as you gradually progress, because you don't want to start being radical. So because there are the category of women that minimal procedure will have profound outcome. So you start with PRPs, just to enhance the G-spot, then roll you over to laser. If that doesn't work or doesn't give you the desired outcome, then we opt for surgical. Yes. That is for cosmetic gynecology. But if it's a reconstructive, maybe you had a perineal tear, you had a very bad episiotomy, or you had a trauma, you have to immediately go to a reconstructive option. Because if it is a structural deficit, with that, if you don't reconstruct, it doesn't matter how many lasers you've had. It cannot really bring back the anatomy together. Yeah. Good.
That's why you need a plastic surgeon.
So, in conclusion, I think we are very happy to have a multidisciplinary team when doing these procedures, because you cannot, as one specialty cannot handle the entirety of the human body, and having insight from gynecology, cosmetic gynecology really helps us to have the optimal outcome for our patients. So, thank you very much. Send more questions for Dr. Victoria and myself, and we'll be able to answer some of them in the comments. Thank you.
So thank you very much for joining me. I want to give thanks to Dr. Ajujo for also enlightening us on what plastic surgery is about. And for myself, as an obstetrician and gynecologist, I'm looking forward to this team effort to see how we can help women and girls get what they want and where they need it. Thank you.